Next panel on the topic data-driven diabetes management. 537 million adults in the world are navigating the challenges of diabetes, which is why the need for innovative and effective management strategies has never been more critical. This panel will explore how leveraging big data and advanced analytics can revolutionize the way we approach diabetes care. From personalized treatment plans to predictive analytics for complication prevention, we're set to uncover how technology is paving the way towards a healthier future. Please put your hands together for this session's moderator, Lawrence Margolis, founder and CEO of Personal RX, and of course, our panelists. Come on up, guys. Thanks for being here.
Thank you.
You're welcome. Oh, you're mic'd up. Great.
Good afternoon, everybody. Welcome. Thank you for having us. We're honored to be here today. Wanted to first do a little introduction for everybody. My name is Lawrence Margolis. I'm the founder and CEO of Personal RX. We're a pharmacy that's licensed in 47 states. We take care of, from a technology and a pharmacy point of view, we take care of people who want to age in place, particularly those that have diabetes and other types of medications. Our average patient has somewhere between 8.7, 8.8 medications, and we do a great job reconciling all that. So this is a very timely topic for us and for our guests as well.
Thank you. Thank you, everybody, for having us here today. My name is RJ Kedziora, co-founder, partner, the custom software development data analytics company called Esteemed Solutions. 20 years ago, we got our start with a congressional grant for the development of a diabetes disease management solution for military healthcare. We were fortunate enough to work with the Joslin Diabetes Center, Walter Reed Army Medical Center, the Boston VA, the Indian Health Services here in the US, developing new innovative approaches to managing patients with diabetes. So fast forward 20 years later now, we work with a number of clients, big corporations, startup organizations, helping them develop their solutions they take to market or make more efficient use of data within their practice. Thank you for having me.
Hello, everyone. My name is Arvind Veluvali. I'm the Chief of Staff and Director of Partnerships at January AI. We were founded in 2017 with a mission to help 1 billion people prevent chronic diseases. We started with metabolic disease because it's simultaneously one of the most preventable, but also one of the most pernicious forms of disease. Right now, there's two extremes. You can either have a lot of information about your metabolic health, it's invasive and expensive, or you can live without any information for free. What we do is we create a happy medium. We give people information about their metabolic health at a fraction of the price point of traditional programs. This is enabled by two apps, our legacy app, which utilizes continuous glucose monitoring, and our brand new free app, which you can find on the App Store under the name January Glucose Tracker.
Hello, everyone. My name is Kay Lim. I'm the founder and CEO of Heartful Sprout. We are a nutrition platform that helps parents feed their babies and children healthier through data-driven solutions. Right now in the US, 1 in 4 children have some kind of health condition that's related to nutrition. That includes obesity, and our mission is to take away the guesswork from parents when it comes to nutrition-related health matters. And thanks for having me here in this great panelist.
Hi, everyone. My name is Puriya Sadegi. I have two companies that I'm the founder of. One is Canada Clinics, which is a number of clinics in Ontario, Canada, and we use technology to make it more efficient for our providers and give them the ability to care for a larger cohort of patients because the main problem I'm tackling with both of the companies is physician burnout and a lack of access to medical care in Ontario, Canada. And it's a really big issue there because it's a universal healthcare. People have paid for their healthcare through their taxes, and not being able to get access to a family doctor actually kind of stops them from being able to access healthcare because everything runs through family doctors. So that's one company that I've founded and started, and the other one is I'm the Chief Medical Officer and co-founder of doTERRA Health, which is a technological platform, which is in progress. We're working to, again, make the patient-doctor interaction efficient by capturing the visit in digital form, not just by speech to text or the scribe models, but a lot more than that. We also use AI to summarize and categorize data and basically make the whole administrative burden on our physicians minimal as much as we can. So I myself focus on diabetes in the practice. My providers provide most of the care to our patients in other aspects of their health, but I'm mainly the guy that deals with diabetics.
Thank you. So let's get into some questions. Let's take a broad view, a broad stroke, if we could, guys, to start this off. And let's talk about what the hottest topic is when it comes to diabetes from your perspective. Who wants to start first,
I can start.
please?
Hottest thing right now is Ozempic or Manjuro or those
Wegovy?
Wegovy. Those medications that are designed for blood glucose management, but end up being used for weight loss and weight management. I think that's the hottest topic, and the use and maybe overuse of those medications is something that we see uh, some good and some bad. I would say the good is that, yeah, it's battling metabolic disease to a certain point, and it's also um, you know a really good tool to use for our diabetics. The bad is that because of the uh, very the problem of overuse, maybe for the other purposes of weight loss, the medication, especially in Canada, has become very difficult to continue our diabetics on because there is a shortage. Every few months, we get these faxes from the pharmacies that, oh, it's in back order. We don't expect any more medication for the next 2 3 months. So what do we do then, right? That's in my opinion.
We get calls on that at the pharmacy all weekend long, people looking for those medications and looking for different alternatives, the semaglutides, the compounded medications. I think we're all kind of in the same area when it comes to that. Okay, from your point of view, you look at it from a different point of view. You look at it from a nutritional point of view. So how do you see the drugs coming in? And that was really the next question about the newest treatments. But from your perspective, how do you see things in the diabetes industry right now?
Yeah, thanks for the question. From nutrition perspective, there has been a lot of emphasis on prevention. So trying not to get the diabetes from the beginning. And when it comes to healthy eating, we have seen so many trends about vegan diet, a little bit of keto, but when it comes to children, it's more about balanced food and avoiding processed food. So there's been a lot of movement in terms of behavior change and also trying to form the healthy eating habits from the very beginning.
Thank you. Arvin, how do you see this?
Yeah, so I would echo what the doctor said. I think GLPs are an amazing achievement to achieve the levels of weight loss consistent with bariatric surgery from an injection is truly remarkable. I think the flip side of that is we live in a very pill-oriented culture, for lack of a better word. We rely a lot on silver bullets, or we want to, in the United States. And despite their remarkable effectiveness, these GLP-1 drugs are not a panacea. At the end of the day, weight loss is a thermodynamic question, right? So you can inject carpet bomb of GLP, but that doesn't necessarily mean that you're enabling the behaviors that are going to be sustainable, especially when you come off a drug. And from what we've seen in the research, when people come off a drug, either because they can't tolerate the side effects or because they can't tolerate the cost, they tend to regain a lot of that weight back. And so the question to me becomes, how do you create sustainable weight loss while someone is on the drug, but also while they're off the drug? And so I think that A corollary to my answer would be that I think AI has dramatic potential to uh, enhance the effectiveness of these drugs and also perhaps serve as a replacement for people who can't take them, whether because it's cost prohibitive or because they can't tolerate the side effects. I think AI can really serve as a coach in your pocket, an AI nutritionist in its best case, where we can reinforce a lot of these healthy behaviors that will lead to sustainable weight loss and healthy habits that can last a lifetime.
RJ, how do you see it in the
Yeah,
software and business?
I come at it from the data perspective, being a technologist, but I also recognize the behavioral aspects of it. Like technology is good, but it's not the answer. It's not the solution. Diabetes is a very personal condition that you can have, and we heard a lot this morning how you can eat better, be more physically active. You don't have to run a 5K. Getting off the couch, taking the steps instead of the escalator is going to make a difference. And as we've seen this data improve over the years and years, 20 years ago, finger stick was really the only option. Very single point in time measurement of what was happening. Not, you really couldn't understand the dynamics of what was going on. Fast forward 20 years now, the CGM devices that are out there, and there's two now that are approved over the counter to make them much more accessible, which is awesome capability. But I wear the Aura Ring. Apple Watch tracks all sorts of metrics. So we are understanding food, how that has an impact on your blood glucose levels, that you can take medications to help impact. But also, if you move and you're more active, that can help better control your diabetes, your glucose levels. But even more importantly, as we advance the science, sleep. Sleeping makes a big difference. Your stress levels make a big difference. A certain amount of stress is probably good for you, but too much is bad for you. So how do you find that balance? And if I eat blueberries for breakfast this morning and go for a 5 mile run, and you eat blueberries and go for a 10 mile run, it's going to have different, impact on that body. So the more that we can use technology, but with a very human facing component so that everybody can understand that data, can really make a difference.
I agree. And when we talked earlier about technology, and we talk about what we do as a pharmacy. And I jokingly say we're half a technology company and half a pharmacy, and the other half is regulation. Uh, but we look at creating tools for our patients so that we can coordinate all of these different aspects in, make sure people get the medication on time, make sure they have the right medication, make sure that medication is reconciled so that people are getting the right meds at the right time and getting reminded of when they need to take it. So I think that's the biggest thing. And what I look at here, and in my notes it says we have the four smartest diabetes health technology people in one room. I'm not sure whether we're the four, maybe five of us, but I think we have a lot going on in this group. And you were speaking to big data, and data, what's it telling us about behavior movement? So maybe we can each take a couple minutes and say, how could we take these four or five diverse types of ways, everything from nutrition to a physician to electronic health records, and all of the different technologies here, and a pharmacy, and how could we make a package that could make things much better for everybody? So I'd like to go in that direction if that makes sense to everybody. Who would like to start?
You're looking at me again. um, well, I think in an ideal situation, all those different parameters, that all those people that you just named should be working together. And we need, well, for example, we need the data to be able to use that as feedback on what we're doing as a clinician, and use that data for the management, or fine tuning our management. How's that data gathered? How much data do we have? Um, I think with the advances in technology in the past 1 to 2 years, even, I don't think there's any shortage of data. It's just that the problem is we have all this data, but is your doctor going to sit there and sort through hours of data about your blood sugar to give you some feedback? I don't think so. That's when AI comes into place. to summarize that for your physician, for yourself, for your nutritionist, so that they can give you proper advice. And if we work in teams with the pharmacy and the technology enables all of this, right? But
Sure.
the pharmacy and the physician and the nutritionist and so on and so forth, if we're working as a team, then we can actually find a really uh, a winning formula there for our patients, for our people that we're trying to influence their life in a better way.
I agree.
To build on that, there is a lot of data that's being generated. To ask a physician to go through and parse all that data to make sense of it, we have a problem with physician burnout in this country, and adding another hugely complex task onto physicians' plates isn't something that's really feasible. If you consider the medical landscape, especially here in the United States, 1 in 3 people doesn't have a primary care physician. And for those of us who do, we probably spend in aggregate less than an hour with our PCP throughout the course of an entire year. And so when you consider the fact that a lot of our health is composed of the decisions we make on a daily basis, involving a human physician in that becomes increasingly infeasible, either due to demands on physicians' time or just the cost. So I think that's where AI can really play a dramatic role. As a companion that's always on, can provide instant feedback, never needs to rest, is infinitely personalized to you, and remembers everything from all of your behavior that's being tracked, either because you wear a wearable device like an Oura Ring, because you log your food consistently, because there are easier ways of logging food. Those are things that apps can provide, like the January app, for example. So I do see, yes, the role of the physician, but I think at the end of the day, health, especially if we want health to be more preventative, is a personal journey that we take every day. And that's not necessarily something that we can count on physicians for at least 100% of the time.
As we create all of this data, to your point of, if I walk into my doctor and I think he's a great doctor, but I'm like, hey, look at my Oura Ring data and look at this data, they're just going to laugh at me because they don't have that kind of time to do it. So how do we synthesize that information and pull out what is most important, and probably even more, what is the right point for the healthcare system to intervene with that patient? When can you make a difference? Do you have a change in medications, a change in your physical condition? Okay, now's when the healthcare system should engage with this patient and move from that sick care to a wellness care industry. My hope is with technology is it just continues to fade into the background and it just becomes part of our life. We don't have to think about it. I wore some very early on, monitoring systems where you had all sorts of wires going all over the place and they worked, but it wasn't very convenient. I didn't like wearing the Apple Watch because it just doesn't feel comfortable, but your ring works really well for me. I don't have to think about this anymore. It's just in the background. So the more and more that gathering of information and presenting it to us, predominantly today on that smartphone, because where are you, how many people have their smartphones in their hands right now? It's like that's where you're seeing this information. So if you can surface the important information to make an impact on behavior and change when it's appropriate, I think it's a powerful solution.
And I would like to add in terms of for from pediatric nutrition side, data and AI has rarely disrupted pediatric nutrition. So we have so many solutions, data-driven solutions for adults diabetes management and any other health management solutions. But in pediatric nutrition, only like even basic analytical tools are not there yet. That's why Heartful Sprout is trying to what we're trying to bring to the table. We want to bring analytics tool between nutritionists and medical professionals and also parents, so that it can be the common ground when we talk about data-driven nutrition management.
Mhm. I think that all makes sense. And, that filters down to being with the patient. And you speak about personalization and you speak about how your Aura Ring is getting your data and a doctor isn't going to have time to analyze that. Correct. They don't. Nutrition, but you take all of these inputs and you put it together. And what you create is a lot of information that even somebody on a pharmacy level can get down to that patient and through the doctor and give some opinions as to what's going on. Coordinating all of that, again, making sure that everything is personalized for that specific patient. So I think it makes sense. And I think that's where we all become very disruptive in what we could do as a group together and how all of the different aspects of what this panel does work in conjunction so that we can save lives and help people and make it a better life, keep people out of the hospital and improve things. Um, so from there, who has any other information or thoughts on technologies or the basics in diabetes where we can make a difference?
Yeah, one thing that I will say is that our awareness of different metrics directly correlates with how accessible that data is. Michael Jordan famously was tracking his steps when he played for the Bulls, but the problem was that required someone to physically count the number of steps he would take during a practice. And now we have the Fitbit, which popularized the notion of taking 10,000 steps. We have an Oura Ring, which tracks our sleep. We have the Apple Watch, which tracks different cardiac events. And now we have new generations of continuous glucose monitors, especially as RJ pointed out, things like the Dexcom Stelo approved just a few weeks ago, over-the-counter continuous glucose monitoring. So I think that as these devices become more accessible, just like people didn't necessarily care as much about their step count, but started to care once things like Fitbits or pedometers became more accessible, things like blood sugar, which people don't care about until it's too late when they potentially have diabetes or even pre-diabetes, this information becomes a lot more accessible when things like CGM are available over the counter, when there are technologies like the January AI app where you can assess blood glucose impact without ever having to wear a CGM. So I'm optimistic about these technologies being used to make all of this information more accessible, but more than that, more meaningful to the average consumer.
So how do you drive that personal story for the person with diabetes? How do you make an impact on their life? We've all talked a lot about technology, and that's my day to day, but this is an interesting study we ran probably a dozen years ago was just the idea of patients taking photos of their food with their smartphone. Everybody nowadays has a smartphone, taking pictures of it. And not only did you see, as you shared this information with your care team, see, okay, I had a steak for dinner, I had baked potatoes. Well, when you're doing that nutritional log of what you eat, you forget that you put, the two things of butter on it or the sour cream because human memory is fallible. Like you're not going to remember all those little details. So just taking a quick photo, not using any specific app, just use your iPhone, your Samsung phone, take those photos, reveals a lot of information. And not just what you eat, but then it also showed you, okay, the 2 liter of Pepsi that was sitting there, or the ashtray. The patient like, do you smoke? No, I don't smoke. Well, there's the ashtray with the 10 cigarettes in it. So now there's a point again to intervene and talk to the patients about their life outside of the care encounter.
So what you're really saying is that it's preventative measures, seeing it, understanding it. You know what they say, if whatever you're eating when you're standing up doesn't count. Well, if you take a picture, all of a sudden it's going to count a whole lot,
Right.
right?
Kid calories count.
Exactly. So, but it's putting all of this data together and it's using it in a meaningful way to affect people's lives, right? And the nutrition aspect, I think, is just as important.
One more thing I want to add. Uh,
Yes.
Something that I've seen be very effective in my patients is the use of technology to initiate that first step of learning about how your food affects your blood sugar. So with the new ways of this data driven diabetes management, yes, it's really difficult for physicians to sit there and interpret all that data and give feedback to the patient. But you know what? If you can have your continuous glucose monitor tell you that your blood sugar was such and such, and I'm not going to use Canadian metrics because you're not going to understand. But let's say if it was 125 and then you had a meal and it's all of a sudden 200. So what is that going to tell you as a patient? Then you should change something about that. And you can actually, so this is an exercise I do with my patients is I tell them, you know what, write down what food you had and your blood sugar before you had that food and an hour and a half after you had that food. And then try to use some kind of alternative in what you personally think without any education might have caused that, you know, increased blood sugar after that meal. And come back in a month and a half and we'll talk about it. And you know what happens? Most of the time, they don't need to come back because you can tell yourself what you did wrong and how you can fix it if you have that information. If you know how this meal affected your blood sugar, if you don't have to go, do a finger stick every half an hour to see what your blood sugar is.
And so what you're really saying is education. And we were talking when they introduced us. They mentioned a quote that 1 in 5 people don't know that they have diabetes, or who 1 in 5 not even being aware that they have diabetes, right? So if you think about the education and you think about how all this plays into it, it kind of makes sense just to be a little more observant. Not necessarily technology, but nutrition, just thinking ahead about what you're doing and how that's affecting you. So all of that makes sense. Is there anything else anybody would like to contribute?
Yeah, I would
Hey,
like to add
please.
one more point. One thing that I'm really excited about how data and AI plays a role in nutrition is really understanding the personal preferences. So there are a lot of guidelines like you should follow this kind of diet that can benefit your health. But if that doesn't really stick to your lifestyle, then it's really hard to keep that. What data and AI does really good is that it understands you through your own data. It can personalize the experience through understanding your lifestyles. I think that has gonna disrupt the nutrition industry when it comes to like what data and AI plays a role here.
Yeah, just to build on Kay's point, um, I think it's a really well taken point. I think that one of the reasons why a lot of diets fail, a lot of nutritional interventions aren't successful is because it's too much too fast, right? If someone wants to eat pizza and you tell them to eat a salad, they're not going to eat a salad because it's just so completely different. And so I think one of the benefits of AI is that you can find something that's semantically very similar to a pizza, for example, and walk people into that end state rather than pushing them all the way there from the absolute outset.
That makes a lot of sense. So with that, I think we've been talking for about a half hour, and I think it's time to take some questions. I hope there are plenty of questions for us here in the panel. And who has a question for us? Hi.
Yeah.
Absolutely.
I think um, there should definitely be some alternatives that are not costing nearly that much. And I'm happy to talk to you about that afterwards. But there is an issue generally with using continuous glucose monitoring for type 1 diabetics because type 1 diabetics are not able to make any insulin. Their body does not make it. It's an autoimmune issue. So the CGM, it detects the sugar not in your blood, but in your interstitial fluids, which is not as accurate. And when we're dealing with type 1 diabetics, we're dealing with having to give them insulin to correct the blood sugar, which has to come with very the more accurate that data is, the better our ability to manage that. I think insulin pumps are probably the best choice we have at this moment in time. I think maybe technology and AI and all of that will play a role in making that more accurate in terms of delivering the insulin. at a timely manner. But um, I don't know if it's actually something that's favorable to have the CGM, and giving out insulin based on those values.
Yeah.
Yes, there are not many solutions for the kids right now.
Yeah. There are
Yes.
two new over-the-counter CGMs that have been approved very recently. I don't know how much they cost, and I want to say the more recent one, I don't know how young the age went for it, but I would definitely just investigate those. But like I don't know how much they cost. But yeah, I know the ones that are available, the CGM sensors that are available for the general public are limited. They are not the same, like, yes, they look the same, but they are limited in their range of calculations. And if you are a patient with diabetes, do not use one of the sensors meant for the general public because it will not read your highs or lows because it's not designed for diabetes. So there are different use cases there. So yeah, make sure you're buying the appropriate one these days.
And I can't tell you how much they cost here because I'm from Canada, but we have sensors in Canada that cost $100 a month. I mean, you maybe take a you know you take a plane ride over there, grab some, and come back. If it's $10,000 a month here, it's worth it. Um, it's $100 a month over there for those. But those are not over the counter; those are prescribed. Um, and again, but as a physician, I would rather have blood sugar for a type 1 diabetic, an actual blood sugar reading, rather than a interstitial fluid sugar reading. That was another question.
Thank you. I see one back in the corner there.
It's a really good question. I think that right now our interfaces with our physicians are relatively limited. A lot of people can't afford to see their primary care physician. Those of us that do don't spend much time with them. And so, yes, I totally understand the approach that you shouldn't be a doctor, and I don't think AI is ready to be a doctor, or I don't know if it will be. But I think that going to it for advice more along the lines of a health coach rather than a physician, where you ask it for general suggestions. What should I eat today? What are the kinds of things that I should be eating? Those aren't necessarily things that you need a physician for. Yes, if you're asking, should I be on this medication? Should I be on that medication? That's probably something to talk to a doctor about. But I do think there are a number of use cases that aren't necessarily that intense that AI is perfectly capable of handling at this moment.
As a physician's perspective, I would say sometimes it's good, sometimes it's bad. So, it allows patients to advocate for themselves, which is a good part. But then sometimes you get some people who are more anxious about their health, and then they've read something that is far from the truth but a possibility, and then you have to spend hours convincing them that they're not dying, as opposed to giving them more beneficial information. So it's just is, I think. It's not necessarily good or bad. I think it's just our new reality, and
Mhm.
and people are going to do it because they care about their health, and sometimes it's very, and always it's readily available, at the palm of your hand. So to make a appointment, go see a doctor, and get 5 minutes to have them explain something to you, might not be enough for a lot of people, and it's not. So they go to other sources, but I think as long as we understand that that information is coming from AI and it's not coming from a doctor, and take that information with a grain of salt, it's okay.
Thank you for that. I think we have time for one more question.
I would say 100% have that conversation. I think then you might get handed off to someone that has more time because that physician doesn't have that time. They're off to the next appointment. But talking to the nutritionist or an exercise coach and those types of people will be able to help you better understand that data and really learn from it. But yeah, there are definitely people in the healthcare realm that work with your doctor, one of the nurses, and kind of thing that can provide a lot of information from that. But yes, having that information and sharing it, extremely valuable to getting feedback.
And I think that also having that information is just valuable to anyone managing a disease. It's pretty well researched that when someone steps on a scale in the morning or when they use a food log, they tend to lose weight. They tend to have better glycemic responses just because most people have no notion of what they're putting in their mouth every day. And that's the biggest determinant in things like metabolic health. And so ways of making tracking easier, I think, will enforce that behavior. I would encourage them to download perhaps the January app. It's completely free and it not only allows you to take photos of food and get accurate macros very easily, but also takes that next step into showing you the blood sugar impact that results from a food without the need for any sensors. And it's free on the App Store right now.
Great. Thank you, everybody. Thank you to the panel. I think everybody did a great job. I'm glad we got to meet each other and learn more about what we do, and hopefully share some wisdom and learn from all of you over the next few days as well. So thank you.
Thank you.